let's talk about the cycle of the bitch. The first cycle of the bitch, the onset of puberty, occurs in general between 6 and 12 months of age. But sometimes, certainly in Eastern breeds, the first cycle can occur on as early as 4 months of age. In the opposite, the more close to the nature breeds like Wolves and Basenji, there the first cycle can occur on an age of 18 months or later. In general, we can say that the smaller the breed, the earlier the onset of puberty. In practice, we see on a regular basis a false cycle. A false cycle means that a bitch is coming in season, she's bleeding for a few days, and suddenly the blood loss stops. A few days later, or a few weeks even later, cycle starts up all over again, and we can have another false cycle or a normal ovulatory cycle. The cycle itself, normal cycle of the bitch, lasts approximately for 3 weeks, with 1 week of blood loss approximately, but there is a lot of variation in nature, and these types of cycle are normal with no influence on fertility, or there is no pathology involved. The intercycling interval in general lasts approximately 6 months, but also here we have a great variation. There exists a great variation, and sometimes we have an intercycling interval from 5 months or a year or longer. Only when an intercycling interval is less than 4 months or longer than 1.5 years, then we can suspect that there is a problem, and then we advise to do an examination of the bitch. Two problematic types of cycle are the silent season in first place. Here we have a bitch that is cycling but has no external symptoms of cycling. So there is no blood loss, there is practically no swelling of the vulva, and sometimes those bitches are attractive to males, but not always. Second problematic type of season is a split season. Here we have a beginning cycling, a beginning blood loss, few days, and suddenly blood loss stops again, as we talked about in false cycle. Few days later, cycle starts up all over again. Only the big difference with the split season and the false cycling bitch is that now the cycle continues and not starts up from day one. So when a bitch stops cycling after a week, the cycle will continue on day 8 and not on day 1. That means that in both types of cycling, a close checkup of the bitch is necessary to get those bitches pregnant. To breed, the timing of mating is extremely important. So in here we have a few parameters that we can use to determine the time of mating. First of all, we have some clinical signs. We can see the type of blood loss that the bitch shows at that time. Is there the vulva, is it swollen, is it still hard? How is the reflex of the tail? Is the bitch, is she standing, yes or no? Is she attractive for males, or is she aggressive for males? Those clinical signs can be helpful to determine the mating time, but there is too much variation, clinical variation, so we have to use some extra parameters to be certain that the bitch is at the right mating time. Therefore, we can use, for example, vaginal smears. By the use of vaginal smears, the aim is that we see under microscope a maximum of great cells with no nucleus inside, because this type of cells will be produced due to a maximum influence of estrogens. and we have a maximum influence of estrogens very close to ovulation time. So what happens is that in the beginning of the cycle we have in our vaginal smears little cells with big nucleus, and during the cycle those cells are becoming bigger and nucleus is becoming smaller. And at a certain time, practically ovulation time, we will have big irregular cells with very small or absent nucleus. And this is the time that the bitch should be mated. Another possibility, another parameter that we can use, or tool that we can use in practice, is a vaginoscopy. And here we are looking into the vagina and looking to very specific changes in the vaginal wall that determine the ovulation periods. What also can be used is the ultrasound. And with ultrasound we look directly to the ovarian and we try to see for the, we see ovulation happening. I mean, when we do ultrasound and the bitch is before the ovulation time, we can see the different follicles on the ovarian. So here we can see really that the ovulation didn't occur at this moment. So we have to do a daily procedure with echo, and a certain day those follicles will be absent, will be away, and then we are certain that at that time ovulation had occurred. Because all this, all those tools that we can use have to be done practically on daily basis, it's a very, can be a very expensive hobby for the owner, and a more used tool in practice is the measurement of progesterone. Progesterone is a hormone that is produced by the ovarian in the bitch, and also progesterone is produced before ovulation. In human, progesterone is only produced after ovulation, but in a bitch it's already produced before. We take a blood sample of the bitch, and I advise to do quantitative measurements, because with those quantitative measurements we really have a number, we have an amount of progesterone in the blood circulation of the bitch, and now we can give the owner of the bitch correct information about the period that we suspect the ovulation. Ovulation occurs around 6 nanogram per ml in every bitch in every cycle. So that's a very strict criterion. And very important to know is that the egg cells need 48 hours for maturation after ovulation. So what we do is we try to find or to determine the period where the bitch is on 6 nanogram per ml, and then we know we still have 48 hours before maturations, and those egg cells stay fertile for another 24 till 36 hours. This is a curve from several bitches where you can see that before ovulation time, around 6 nanogram, that before ovulation time you can have very different levels of progesterone, going up, going down even, but after ovulation time there is a really big variation, and it means that some bitches will have 10 nanogram a day after ovulation, but some bitches already will have 20. So, but that isn't important anymore. It is the level of 6 nanogram that's important for us. Let's presume that mating was a success. The owner wants to know as soon as possible if his bitch is pregnant, yes or no. So also here we can use some clinical signs, or we have several tools, but the clinical signs are not always present in all bitches. Sometimes those clinical signs are poor, sometimes they are completely absent, but what happens in most of the time is that around 4 weeks of pregnancy, most of the bitches will lose a clear vaginal discharge. Also, nipples will become bigger and will swell up. The abdomen can become a bit harder. Some breeders talk about changes in the character of the bitch, but those are all very subjective parameters, and we can think the bitch is pregnant, but we certainly are not certain about it. So another tool that we can use, and that breeders do use, and also their vets, is abdominal palpation. By careful abdominal palpation, let's say around 28 days is the most easiest day to start with, we can find very easily separate egg-shaped entities into the abdomen, and there is no confusion possible with other abdominal structures. We have 100% certain that this indicates pregnancy. From the moment you have enough experience to use abdominal palpation around 28 days, you can try to do it in an earlier stage, and it's possible around 24-25 days. From the moment you pass 30 days, 32 days, then it's practically impossible to feel if the bitch is pregnant, yes or no, due to the fact that those separate entities will become one voluminous mass, and that is confusing with other abdominal structures. So the use of hormonal measurements to determine if the bitch is pregnant, yes or no. Here we can use, or there are two hormones possible. One hormone, the progesterone, that's the hormone that is tested in humans, is of no use in dogs, because progesterone always stays high in a bitch, mated or not mated, in every cycle. So measurements of progesterone will not reveal pregnancy, yes or no. There is another hormone, however, relaxin. It's a hormone that's produced by the fetal placenta, and we can test it and we can find positive results after 4 weeks of pregnancy. When you do this test in an earlier stage, you can have false negative or false positive results, so you really have to wait 4 weeks before you can use this. So in practice, because we want to know as soon as possible if the bitch is pregnant, yes or no, so in practice, most of the case we use ultrasound. It's easy. We can use ultrasound from 24 or even 1 or 2 days earlier, but what we don't want to do is to give an exact amount of puppies. Certainly not when we do ultrasound in a later stadium. When we do ultrasound around 28 or 27 days, it's practically impossible to give an exact amount of puppies. So this is a view of an ultrasound where you can see on a very easy way that there are different ampulla with inside the little puppy present. Radiography, ERICS, we practically don't use for pregnancy diagnosis, because it's only useful in a very late stadium, because the skeletons of the puppies have to be calcified, and that starts up from day 42 to 45. So then we have other possibilities to know if the bitch is pregnant, yes or no. So the only reason why we do use ERICS is to make an exact counting of puppies, certainly when we expect delivery problems or when we see that there is an abnormal small litter. And then you can see, as here, different heads and bodies of the backs of the puppies, and then we count the heads and the backs separately, and of course we need the same amount of heads and bodies.